Completing the Nebraska Death Certificate, presented for physicians, physician assistants, and certified nurse practitioners. Each state has its own process for filing death certificates, vital statistics laws and regulations indicating how and when a death certificate will be filed when the death of a human being occurs. All death data is filed with the National Center for Health Statistics, which maintains all death data for the United States, the Associated Territories, and possessions. The data is used by researchers and the government to plan and fund research and programs that impact health and safety. For these reasons, it is important that the death certificate be completed as accurately as possible and to have a clear understanding of causes and circumstances surrounding the death. Nebraska Revised Statute 71-605. Death Certificate. Cause of death. Sudden infant death syndrome. How treated. Cremation, disinterment, or transit permits. How executed. Filing. Requirements are that the death and fetal death certificates shall be completed by the funeral directors and embalmers and physicians, physician assistants, or nurse practitioners for the purpose of filing with the department and providing child support enforcement information. The physician, physician assistant, or nurse practitioner shall have the responsibility and duty to complete and sign in his or her own handwriting or by electronic means pursuant to Section 71-603.01 within 24 hours from the time of death, that part of the certificate of death entitled Medical Certificate of Death. There is no perfect world for completing death certificates, but the time frame for completing them is an important source of information in regards to public health. Death certificates, when completed correctly and analyzed properly, give insights into areas of concern, such as major causes of death, but also more in-depth information such as accidents, suicide, and even chronic diseases for specific populations, times, and locations. The death certificate serves many purposes, including legal documentation that the person is deceased, information about the deceased such as age, sex, race, date of birth, place of birth, and other descriptive data concerning the deceased. Contain information concerning the cause, manner, location, and circumstances of the death. Information to be used in legal functions of the deceased. Information directed toward possible criminal prosecution. Information concerning burial and disposition of remains. Information directed at the review and research to be utilized by local, state, and federal agencies and public health entities. There are 3 steps to the completion of a death certificate in Nebraska. Funeral home initiates the certificate. Cause of death is completed by the appropriate physician, physician assistant, or nurse practitioner. Registration with the State Vital Records Office within 5 business days. The funeral home is responsible for filing death certificates with the state. The individual responsible for the completion of the cause of death section of the death certificate will usually be the medical certifier who last attended the decedent, knows the medical history and contributing medical information relating to the cause of death. If death follows a live birth, then the medical certifier completes a birth and a death certificate. For those cases involving fetal demise or stillbirth, the medical certifier completes a fetal death certificate. Deaths that are unattended or caused by neglect, violence, accident, the sudden and unexpected death of a child 1 week up to 3 years, or any other unlawful means, are the jurisdiction of the county attorney, county coroner. In Part 1 of Cause of Death, specifically state to enter the chain of events, disease, injury, or complications that directly caused the death. The first part is for reporting the sequence of events leading to death, proceeding backwards from the final disease or condition resulting in death. Each condition in Part 1 should cause the condition above it. The immediate cause of death is the final disease, injury, or complication resulting in the underlying cause of death that directly caused the death. Do not enter terminal events, such as cardiac arrest, respiratory failure, or ventricular fibrillation, without showing the etiology. Do not enter abbreviations if possible. For each cause or condition, indicate the approximate interval to the onset of death. For some deaths, the sequence of disease involves conditions that occur at a time between the underlying and the immediate cause of death. The actual underlying cause of death should always be listed on the lowest line. For lines B through D, sequentially enter the list of conditions that were due to or a consequence that led to the cause of death as entered on line A. Part 1 and Part 2 of the cause of death are the most important sets of significant information on the death certificate. It provides medical information that serves as the basis for describing trends in public health, mortality, and for analyzing the conditions leading to death. It is important that the medical certifier list the risk factors involved with this death. This information provides a basis for research in disease etiology and evaluation of diagnostic techniques, which, in turn, lead to improvement in patient care. Data Field 18, Part 2, Other Significant Conditions, is reporting all other significant diseases, conditions, or injuries that contributed to death, but which did not result in the underlying cause of death given in Part 1. Data Field 19, Was medical examiner or coroner contacted, provides important additional insight into the condition that led to death. Data Field 20, If female, is an inquiry into past and present pregnancies. This information is important medical and public health issues and measures the quality of the healthcare delivery system. The information is used to improve the cause of death and help identify maternal deaths. Data Field 21A, Manner of Death, is used to obtain a more accurate determination of the cause of death. In most cases, the cause of death will have been the result of natural causes. Data Field 21B, If transportation injury, answer if the death was specifically related to a transportation injury. If in doubt, contact the Vital Records Office for assistance. Data Field 21C and Data Field 21D are important in providing additional insight into the conditions that led to death. Data Fields 23A, B, C, and D, the date of death, date the certificate was signed by the medical certifier, the time of death, and the signature of the medical certifier. Data Field 25, Did tobacco use contribute to the death? Is a public health outcome used to measure other health outcomes and health assessments. Data Field 26A, Has organ or tissue donations been considered? And Data Field 26B, Was consent given? If interested in learning or being trained to use the Electronic Death Registration System software, contact Vital Records at area code 402-471-0919.